Okay, well, I will go ahead and get started, and I'm sure some more people will join us, but I want to be mindful of the time because we are keeping this to 1 hour today. But welcome, everybody. I am Martha Shapiro. I'm the Director of Programs here at Senior Concerns. Thank you for joining our seminar series. For those of you who attended our last couple that were over Zoom, you might notice this format is a little bit different. We have upgraded our Zoom to the webinar platform. So those of you who are joining us today will be in listen-only mode. So hopefully this will just look a little bit cleaner for you, although we don't get to see your beautiful faces. But you can still communicate with us. If you look at the bottom of your screen, you might need to move your cursor to see it. There is a Q&A box. So if you have any questions for our panelists today, you can type it into the Q&A box. If you have something you need to tell me about the logistics, if you can't hear us, then go ahead and put that into the chat box for me to see. So thank you so much. We're happy to have you all today. We really, planned our seminar today. The topic is caring during COVID-19, what to do when caregiving becomes too much. And this topic really came from people that we talk to all the time, our caregivers that are doing this every day. We know caring for a loved one at home is normally difficult, right? There's a lot of challenges and stress, and we need to be there to support each other. But now, during the COVID-19 crisis, it's really compounded everything that we're all dealing with. The respite that you might have had before, maybe through an adult daycare or through caregivers or family members, that might have stopped, or you might have had to reduce the amount of people coming to your home. Typical activities maybe you did to keep busy, errands, all of that has changed. So we just wanted to have a chance to get some people to talk about this from different angles and help support you and maybe give some tips and resources. So we have a panel of speakers today to kind of hit some different areas on the topic. And I will let you know a little bit about what's going to happen, but then we'll have one at a time speak. If you have a question that pops up, put it right in that Q&A box so that you don't forget. But we will address the questions at the end so that we make sure we might already address it in what they're planning to say. So we have three panelists today with us. We have Mark Stelzer, who is a social worker, and he's going to talk about caring at home, maybe behavioral issues that come up and how you can best structure your day. Then we will hear from Henahan, who is a registered nurse, and we'll talk a little bit more about the medical side of caregiving and how to get some resources. And then we have Khalilah Heller, who owns a placement agency, and she'll talk about the placement side. If caring at home is too difficult or you're looking for an alternate placement for your loved one. So first, we will start with Mark Stelzer. He is an MSW and an Alzheimer's and dementia expert. Mark is known for consulting, educating, and supporting healthcare professionals, caregivers, and family members. Mark's professional experience includes working in Eldercare as a respected director of dementia and memory care programs, hospice medical social worker for Buena Vista Hospice, and dementia care consultant. And he has also been an Alzheimer's Association volunteer and dementia trainer. So thank you, Mark. I'll turn it over to you.
Thank you very much. I first want to start off by thanking Senior Concerns for putting on this event today. I always appreciate their dedication and commitment to our community. I understand there's a lot of people taking care of folks with dementia at home. I also understand that since the coronavirus stay-at-home order, a lot of people are taking care of people who were doing quite well. And now it's a different situation. And that has created challenges that are very, very large. I want to share with you some tips on being able to have somebody at home lower their anxiety and certainly lower your anxiety. So I want to start off by saying that behaviors are an expression of an unmet need. And what I mean by that is that communication is really challenged for people that have dementia. They don't understand words. They don't understand what you're saying. They try their best, but they get very, very frustrated. And that language becomes damaged. And like I was saying, finding the right word and being able to communicate back to you is a real challenge. I'll go back and say behaviors are an expression of an unmet need. So you may have an individual who is not understanding and you're asking them to do something. Maybe it is toileting and you're trying to get that individual to do that activity. They're not understanding. And what you may find is that they slap your hand. And that is something that they may never have done before, but they're frustrated. They're not understanding. And it's very, very important for us to do this right. And the Alzheimer's Association have included in this presentation a wonderful sheet that I invite you to check out. There's a number of other sheets that are included, but it's called Compassionate Communication. And it has a lot of do's and don'ts when talking with someone, and you will enjoy that. You will benefit from that. I've been using that for many, many years, and every time I go over it, I see something new. I learn something new. So another element of working and caring for somebody with dementia is they always have anxiety. It's always ever present. Do I need to go to work? Where's my children? Did I eat? They always are wondering what's going on, and it builds up for people. So it's very, very important that we're able to communicate with them properly. We're able to understand what's happening. And the example that I like to use is mothers have this intuitive ability to know what is going on for their child. So as a mother, as a parent, you may have recognized the hungry cry. The cry would happen, yeah, there's that hunger cry, or the angry cry, or the tired cry. So it's very, very important that you are paying attention to the individual. And once again, communicating right and having a good strategy is going to make it a lot easier for you. So in the course of having a day, how does that start? I always like to create a structured day that people can expect what is happening. In a community that I worked at, you would have people who would finish breakfast and they would start walking down the hall, and I would walk up and say, well, where are you going? And they'd say, well, I know something's going on in that other room. And we were able to lower their anxiety by always having something going on. So it starts best if you come up with a life story. And that's going to give you the information on what to do and certainly not to do. So if the person was an artist, then you're going to have a lot of activities that are going to follow that. If the individual was a handyman, if the individual liked to garden, if they loved pets, if they were from a farm, if they grew up in the city, it's really important for you, and you may know this, but having it is going to reinforce your ability to create this structured day for them. And the term that we like to use is person-centered care. And that means care provided within the context of a relationship. So I'll share with you a couple of examples where we were able to apply that to people that were resistant. So showering grooming can be a very difficult thing. It can be a scary situation. So a couple of examples that I gave was, we had a woman who did not want to shower, and the typical thing is the caregivers would go in and say, "Hi, Mary, it's your day to shower, and I'm here to help you." And Mary would say, "I already did that." And the caregiver, in a poor sense, would say, "Oh, no, 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 you didn't." And that's going to create a lot of friction. So what we did was we talked with the patient or the resident's daughter and found out that she and her mother always went to the spa. So what we did is, when it was her shower day, we would turn the water on the temperature that she liked. We would get little tea candles that were battery operated, because within a community setting, we couldn't have a flame. We would put on new age music, and we would have that white robe. And we would walk in and say, "Mary, it's spa day." And that was very, very effective for her. She really enjoyed going to a spa. We created that environment, and person-centered care conducted within the context of a relationship. Another example that I share is, we had a man who refused to shower, and unfortunately he smelled horribly. He was incontinent. That's a natural thing that can happen. He enjoyed participating in activities with the other residents, but they just had no tolerance for that. People with dementia, unfortunately, don't have a filter. He would come in, he would smell, they'd start yelling at him, he would start yelling at them, and it was chaos. So we had to figure out a way to be able to make it work for him. I went into his room and I noticed that his wife had set the room up with a lot of photographs and pictures, art pictures of golf courses. So, the light bulb went on. I knew he was a golfer. He had a picture from a golf tournament with his buddies standing on his nightstand, and it was the picture of the guys all standing with their clubs. So I taught the caregiver things about golf. So we would walk in, once again, the water in the shower is on, his pull-ups, his clothes, everything are all prepared. And I'd walk in and say, "Bill, you're going to play golf today, and you have a 2:30 tee time." And tee time is your appointment time in golf. And in his long-term memory, that was something that was meaningful. So I got his attention. And then I would say something to him like, "Well, how's your short game?" And I would start talking with him about golf, always taking his clothes off, continuing with the conversation, responding to him. And the next thing you knew, we were able to get him up, get him into the shower, do the necessary activity. And it was win-win. He enjoyed talking about that. So having that life story information is very, very important. It also is important in creating activities for people. We would have art projects that naturally the women enjoyed participating in, and they would be drawing, or they would be using pencils and doing art projects. And an engineer that was one of our residents would never participate. That's just not something you're going to get an engineer to do. So what I did was, he was our official pencil sharpener, and the women would be doing the art project. He was social, he enjoyed being with everybody, and he would sit and wait. And when the pencils needed to be sharpened, this man, I'll say Bill again, he would sharpen the pencils and examine it, because he was an engineer. It had to be perfect. He had sharpened many a pencil in his career, and he continued to do that. And when he would finish and bring it back, we would all applaud and thank him, because people with dementia need to feel purpose. They need to know that they are participating and people still need them. So that person-centered care is very, very important. I want to give you an example of activities for people that, like an engineer or some challenging men, that are easy to do. So it's very simple. I take a plastic shoebox. And a lot of the things that I fill these with and create these with, you can get at the 99-cent store, the Dollar Tree, any of these inexpensive stores. And what I would do for the handyman is I would fill it with a paintbrush and a light switch. And these are plastic tools that I got at a store, sandpaper, and we would use these as a prompt to engage the people in conversations. And sometimes if you have caregivers, you need to write it out, put it on the lid, give the caregivers the opportunity to be successful. But an example would be, Bill, tell me about a time that you changed the switch on a light. And I would hand this to the person and it would prompt them to be involved. So there's lots of activities that you can do for people that are meaningful and are person-centered. Another example might be for a woman, but for me, I'm a very avid gardener, is to create one, once again, for the gardener. And very inexpensive to buy the gloves and these kind of things that you can have a conversation with people and have prompts. So maybe I'm showing them a picture of roses, of daisies. So these are examples of things that are very, very easy to do. Now, sometimes you are with somebody and you're working from home. A lot of people are having to work from home and you're being bothered. So I one time had an office in one of the assisted living communities, one of the dementia areas, that was in the middle of the department. And people were constantly coming back and forth, and it was very difficult for me to get my work done. So I came up with a pretty easy solution. And one of the things that I would do is I had colored chips. And what I would do is mix them all up, and the person would come up and I would say, Mary, oh, I am so glad to see you. I really need your help. Can you do me a favor and separate these out? Divide them up by their color. Now, going into something specific, I had a woman who was always wandering, always doing things. And I needed to come up with something that was very specific to her. And her family had shared with me that she was an artist that used pastels. And she had a relationship with these colors. So what I did, and unfortunately it's Easter time that you can only find this, but I went to a store and I found construction paper that was in all of the pastel colors. And she would come up to my desk and I would say, oh, I'm so glad that I found you. I'm such a klutz. Can you help me and put these color paper back as the same colors? And it had the pink and all the very pretty pastel colors. And I would find her sitting there, but looking at the pastel paper, the colors, and it was very soothing to her. So this is really the medicine that the social model uses. You'll have in a medical setting, a doctor reaches into his toolbox and he may pull out medications to assist with somebody's behaviors. But as a social worker, within the social model, it's very important to reach in and pull out those things that are meaningful for the person. So I want to show you one other item that is very, very fun. It's easy to do, and you can do with people at all levels. And I went to the 99-cent store, I bought the terracotta pots, I bought the styrofoam ball, I bought the flowers, and I cut them up. And you can do flower arranging with people. You can do it one-on-one. You can help them with that. So I'm hoping to just share with you ideas that you may consider when you're in a situation that's very, very frustrating. The last point that I want to touch on is mask wearing. And for people who have caregivers in their homes, everybody is very, very scared about the COVID and the transference. So they're all wearing masks, but masks can be very, very scary. They can be in a situation where they just don't know what's going on. And as a medical social worker for Buena Vista, one of my roles is to go out with the nurse and meet with families and share with them what hospice service entails. And for families, that can be a very, very heartbreaking, sad experience. And all they see is this. So what I had to learn is to soften my eyes and be able to convey nonverbal cues to people so that they knew that I was paying attention. So caregivers that are hired and brought in, maybe they have to lower their masks standing 6 feet back from somebody to let them know, oh yeah, I'm Bill, hi, how are you? And maybe the other person is wearing a mask, and I know we have this virus and we're all trying to keep each other protected and make it a fun thing. Another thing that I've seen with the physicians and the nurses in the hospital settings is, and I saw this on television, they're getting large pictures of themselves and they're wearing masks and they're in their PPE, but they're able to show people a picture of themselves. And we wear our name tags when we go in to meet with families, and we'll show them our face. So that lowers their resistance. And people with dementia, they're constantly experiencing anxiety. So very, very important that you do the things that are going to help them stay calm, giving you a strategy so that you know exactly what you're going to do, and it can make your life easy. But it's important to take the time and figure out what you're going to do every day. You're going to have your meal. Maybe after your meal, you'll do some chair exercises or walks or something like that. Then after that, you may have a snack with someone, and then maybe you engage in reading the newspaper. A lot of older adults, a lot of our parents' generation read the newspaper every single day. So even though it is something that they can't follow, it's a prompt that is very calming and soothing to them because every day they read the newspaper. So the last thing that I want to leave you with is a concept called anticipating behaviors. And a lot of people experience sundowning. So 3 o'clock, 3:30, they start wandering, maybe they're getting agitated. And if you know that your person does that, it's real important to meet that behavior before it actually happens. So within the community settings, within the assisted living communities, we would always do a little bit more of a physical activity, maybe a ball toss. You can use some of the plush, like a stuffed animal football. You can just do things like dancing and singing, and you want to take some of that angst and meet it and channel it and be able to provide people with an outlet for what they're experiencing. So I want to thank you very much. I want to thank Senior Concerns for doing what they're doing. And I look forward to answering any questions that you might have as we complete the presentation. Thank you.
Wonderful. Thank you so much, Mark. Just hearing all of what you're talking about, I think it's such an amazing act of love to really restructure the day to provide as much joy as you can to your loved one and reduce their stress. And I hope that somebody will do that for me someday. So thank you. The handouts that he's talking about, I will make sure to email those around to everybody who registered for the seminar after today. And our next speaker is Ellen Henahan, and Ellen is a registered nurse for over 35 years and a California resident for over 30 years. She is certified in hospice and palliative care and has been active working in hospice and end-of-life care for many years and is currently working at Los Robles Hospital as a member of the palliative care team. So thank you, Ellen, for joining us.
Thank you. Thank you, Martha. Thank you for having me. Hi, everyone. The most important topic I'm going to cover today is what is the difference between hospice and palliative care? Because everyone thinks they're the same, that it is synonymous, and it's not. So palliative care is really comfort-focused care and relief of symptoms, education, and support. And so I like to think of a big circle as all palliative care, and there's a small circle within that that is hospice care. So all hospice care is palliative, but not all of palliative care is hospice. So when I come into your room to visit you, heaven forbid if you're at Los Robles, I don't want anyone to look frightened. I'm there to help. I'm there to see how we can make this experience better for you. And leading into that, I want to make sure that people know everyone's been really afraid, as Mark referenced, the COVID virus. But I want you to know the hospital's a very safe place. All the protocols and the precautions that have been put into place have everyone maximizing every patient's safety. So we are not having incidents that I know of at all of the virus being caught by anyone. As I know that probably the most distressing thing is that families can't visit. And I know that's very hard, but that's again for your loved one's safety and for yours. We need to limit the number of people coming in and out of the hospital. Now, that being said, please don't delay getting the necessary care for your loved one. If they have an event or a symptom that warrants going to the emergency room, please be sure and get that care for them. I promise we're going to take really good care of them. The nurses are putting a lot of effort into communicating with families. Palliative care can help. The physicians are calling families. We're often meeting families outside on the grounds of the hospital. So just please come to the hospital if you need us. We're there for you. So I want you to think about all the things that Mark said, and I like how he thinks about being proactive. We need to monitor some of the new symptoms that some of our loved ones may have. And so I know that Mark talked about someone who wanders and gets anxious at the end of the day. But if that's a sudden new symptom, that's something you want to take note of. If you're unable to console or distract your loved one, if this is a new behavior and you can't quite figure out what's causing this, jot that down. One of my favorite tools for people providing care at home is keeping a calendar. A calendar is a really useful tool to kind of track the changes or even the patterns. Sometimes by jotting them down, we see patterns that we really hadn't consciously been aware of. I want to encourage you to reach out to your physicians with any new symptoms or signs of distress. And I've had a lot of physicians begin doing what would we call that? Telemedicine appointments. I know I'd written it down. So I've been meeting with my physician to review my blood work just like this through a video conference call. It's a great way to do it. It's much easier for you, so you're not having to transport your loved one. And as long as you have the preparation to accurately explain some of the things that you're seeing in your loved one, it can be a very effective tool. So have your calendar with you. Be ready to talk about some things. Be more specific. And excuse me, but I will refer to my notes. He's restless and agitated. He's pacing the house for 1 to 2 hours. That's a very different picture than just saying, oh, he seems a little more upset, doctor. I want to know what that looks like. What does the upset look like? I can't distract him, and I need to really be careful because I see him trying to get out the house. He's not safe on his feet. Doctor, we've had a real change in his sleep pattern. He's now only sleeping for 3 to 4 hours, and then he's up wandering the house. He's not getting his rest, and I'm up trying to keep track of him and watch him. So that's a real safety concern, and that's a new symptom, something that we really want to be aware of. We need to be aware of bathroom habits. So how frequently is someone urinating? Are you noticing an odor to the urine? Are you noticing if he's not flushing? And excuse me, but I am saying he all the time here. I'm tagging on to Mark, who talked about Bill. We'll pretend it's Bill. So if Bill's not flushed the toilet, is that urine really dark in color? Is it cloudy? Do you notice a strong odor coming off of it? Those are the types of symptoms that you want to make your physician aware of. If you notice that every few days Bill is struggling with a sore abdomen and complaining of discomfort and pain, and you know that that means he needs maybe a dose of milk of magnesia to help him move his bowels, let's make sure and note that on the calendar. Because if we begin to see a routine pattern of having to use milk of magnesia once or twice a week, maybe the physician can help you come up with a milder medication given on a daily basis that would help alleviate that symptom. His mobility, Bill's mobility. Is he suddenly having trouble getting out of a chair? Is he less steady on his feet? Do you notice that the 2 steps up or down from your living room, he used to be able to navigate without any trouble, and now he's hesitant and he's a little unsteady? So these are all things that we want to talk about with the physician. Has he fallen? Obviously, that would be important. Do you notice Bill complaining of more pain? So again, over-the-counter meds are still medications. So if you find that you are giving things like a Benadryl or Tylenol or Advil, or we referenced a bowel medication like milk of magnesia, those are all things we really want to note on that calendar and review with the physician. And maybe there's a better, longer acting medication that could be given for pain. So your loved one isn't experiencing the pain and then we're chasing it, trying to get rid of it. All of those are so important. And I really stress that over-the-counter medications are medications. Just because you buy them at the pharmacy yourself and you make the decision on when to give them doesn't mean that the physician doesn't need to know about it. Medications, as you know, can have interactions with prescription meds. There's limits to how much Tylenol someone should have. We want to know if there's a bowel issue before we keep giving milk of magnesia that seems to not be effective. So how would we get more help at home? So in one of the telemedicine phone calls with your doctor, you might say to him, Bill has fallen twice. He's much less steady on his feet. I'm having trouble getting him in and out of a chair safely. And the doctor might say, I'd like to try some home health visits, and I'd like to send a physical therapist to teach you some safety tricks on how to transfer Bill carefully and safely for you, and some exercises that Bill can do to hopefully strengthen his muscles and make it easier for him to ambulate and safer to be mobile. So in addition to that, you might want to ask, because just as Mark referenced, sometimes our loved ones are a little bit more reluctant to shower. Maybe you could ask the physician to please, could we have maybe a bath aid in addition to that? Because Bill's reluctance to move and his being unsteady on his feet has made him even more reluctant to shower. So requesting a home health aide and requesting home health visits from a physical therapist would be something that you could do at home. And I know a number of families have said to me, but I don't want to let anyone in. I'm so afraid of letting a stranger into the house. I don't know where they've been. So of course that's true. But remember, our trained home health and our healthcare professionals are being meticulous about their hygiene, about using all the PPE they can to keep you and your loved ones safe, and they want to keep themselves safe. So I would please encourage you to accept that help if it is offered. I also want to remember, just as Mark said, you know, this is a strange time. We've lost a lot of the supports that you had one time. You know, you were able to go to daycare, you were able to have lunch with friends, and you got that break. And now you may be at home full time. So you're not only the nurse giving the medicines, you are the physical therapist right now helping your loved one get around. You're the dietitian. You're the social worker trying to create these wonderful activities that Mark's telling you about. But you're also the bookkeeper. You know, you're running a household. You're ordering groceries. You're trying to maintain contact with friends. You know, at a hospital, it takes us an entire team to care for your loved ones. And that's something that you're doing by yourself now. So please be kind and gentle to yourself. Know that there is help out there. Senior Concerns is a phenomenal resource. And if unfortunately you ever end up at the hospital, please be sure and ask the doctor for a referral to palliative care. And let us see how we can help and make that stay better and help you create a plan of care even going forward. So that's all I have, Martha, but thank you very much.
Thank you so much, Ellen. I just want to echo everything she said. All of you caring for loved ones, you are doing everything, and that can be really exhausting sometimes. So don't be hard on yourself. This is the time that all of us need to be a little bit kinder to ourselves. Let some things go, order takeout if you need to, use paper plates if you need to.
Yes.
Focus on what's really important. And Senior Concerns is here to help. We have caregiver support groups every Friday morning over Zoom like this, led by Carrie Salas, who is in the audience listening right now. We also have care consultations. You can talk on the phone or over Zoom with a social worker to talk through your individual situation. So I know we're packing a lot in today, and it might bring up some thoughts that you want to discuss a little bit more in depth. So just call us and we can have a social worker talk it all through with you. And then finally, I'd like to introduce Khalilah Heller. She is one of the owners of Assisted Living Connections, which is a local licensed no-cost senior placement and referral agency. Khalilah's entry into senior living began in 2007 when her mother fractured her hip, then had a major stroke and vascular dementia. Khalilah is a resource and counselor for families, helping them obtain the best information as they explore assisted living and other home care choices together. She is an administrator of residential care facility for the elderly by the state of California, and she's lived in Thousand Oaks for more than 30 years. So thank you for joining us, Khalilah.
Thank you. Thank you to Senior Concerns for putting this Zoom call together today. You know, I've seen how you guys have had to shift from providing adult daycare and all your programs to really expanded Meals on Wheels and a whole food bank, and then delivering all sorts of other meals through other programs to families in the community. And I love that you still have, you're able to offer these caregiving support classes and your social workers. I send people to Senior Concerns all the time and work with them really closely, as well as Alzheimer's Association and the hospital. So, you know, what Tammy and I do at Assisted Living Connections is we really know the assisted living communities in Ventura County, large and small. And for many people, it's not, there comes a time when you're doing everything you can do at home, but, you know, as Martha was and Ellen were talking, that's a lot of roles to be handling at one time. And sometimes with your loved ones, you just can't do it at home anymore and you need extra help. And sometimes bringing in care in the home is a solution. Some people aren't comfortable with that, or it becomes too expensive. So that's where we step in when we help families feel really good about what are the other choices. We work directly with all these assisted living communities. We take our clients on tours, and we kind of work like social workers and real estate agents for senior living, finding the right place to live. Our own mothers have lived in both large and small communities in the Conejo Valley. So what I wanted to update you on is what's happening with assisted living communities in Ventura County right now. These are not skilled nursing communities. First of all, you know, you often hear in the media that the nursing, about nursing homes and having COVID. So a nursing home is a skilled nursing community. And sometimes when someone's leaving the hospital and they need extra physical therapy, or they have an infection that can be handled at a little bit lower level of care than the hospital, they go to skilled nursing. Those are the places where Medicare will pay up to 100 days of care. And those are places that more typically would have someone, if they have the coronavirus, might be in a quarantine area in a skilled nursing community. Our assisted living communities are licensed with the state, and they are overseen by Ventura County Public Health Department, by the Ombudsman of the state, and by Department of Social Services. And in Ventura County, our assisted living communities are doing a great job. Most of them don't have any COVID in them. They're being very careful, and they're, again, following protocols specifically with the Ventura County Public Health Department, and they're on the phone with them every single week as those protocols change. We believe assisted living is really a safe place to be right now. There's all this cleaning and sanitizing going on, infection control, masks and social distancing. And most of our communities, in the larger assisted living communities, people are able to get out of their rooms now, go to the dining room for limited dining that's social distanced. They have activities to attend. Again, social distance, wearing a mask, but they have exercise classes and games. Family members are able to visit by coming and visiting the senior in an outside area where people are 6 feet apart with a mask. So you're getting to see your family member all the time now in our assisted living communities. The communities take the temperatures of the residents and the caregivers every single day. There's all sorts of checks going on. And of course, people are getting engagement and good socialization and meals and being hydrated. So one of the most critical things we're seeing happen is when seniors are alone and isolated, especially in a home, and they don't have family members with them, you know, that becomes really dangerous for not getting proper nutrition, proper hydration, anyone overseeing them, and all the decline with isolation, that there can be a real decline in with dementia or with depression, and a higher incidence of cardiovascular events when people are isolated. So that's something that assisted living communities offer, is a chance for socialization, even during this difficult time. Now, if someone, first of all, Department of Social Services requiring surveillance testing at all these communities. So every 14 days, 10% of the staff and the residents must be tested. If an employee tests positive, they're out of the community until there are 2 negative tests for them so that they're really sure that they can come back in. The community reports all of this, again, to the Public Health Department, the Ombudsman, and the Department of Social Services. So we've been in contact with the assisted living directors of all these communities, and this includes the small residential care homes. So those under the umbrella of assisted living, licensed facilities. You have the large assisted living communities that might have 100 people, and then you have small residential care homes that have 6 people. And those small residential care homes are some of the safest places to be because you have very few staff changes. You have 2 staff on during the day for 6 people, and very strict protocols. Again, people are asking me what happens if someone comes down with COVID in a community. If it's, again, a caregiver, they're taken out of the community. A senior is taken to the hospital immediately if they have COVID, if they test positive or show those symptoms. The community may have to go into a time of a little bit stricter protocols where residents have to be dining in their room. and they'll have everyone in the community tested. Public health is requiring that now. If anybody comes up positive, everyone has to do a full round of testing, all the staff and all the seniors. As soon as they get the clear, then again, visits with family resumes, with social distancing, as well as in-person classes and dining. So we are still moving quite a few people into assisted living because not everyone can take care of their loved one at home. They might need to be in memory care, or there's issues, like I said, with isolation, or they need the extra care. A silver lining, a little positive thing, is that these assisted living communities are responding to this crisis by really lowering their costs. So that's an upside for consumers, and we will help our families with negotiating on rates, but these communities are offering reduced rates across the board. Their occupancy is, they tend to have more rooms right now. And, I have some pretty independent seniors moving into assisted living because all of a sudden they're saving $1,000 to $1,500 a month on their room rate. So we're going to help families, navigate this, and it's like my own mom lives in a residential care home here in Thousand Oaks, and nobody's been sick the whole time, and I'm finding that with most of the locations. You have to be a little careful about what you hear in the media. I got a report recently that all these assisted living communities had COVID. I called them up. They said, no, that was at the beginning. In March and April, we had some cases, but that's totally clear, and we've been fine since that time. So LA County is a much different animal than Ventura County. We're seeing a lot more cases in LA County overall. And I just want to offer this as an option for people to not be scared, because when they work with us, there is no charge for our services, and we're going to just explore what's available, what do things cost. This can be a time when you can move your families, your seniors into a community and have it still be very safe. And it can be a really loving and caring place for a senior, especially I see as seniors who have more and more memory loss issues. It becomes harder and harder for families to take care of them at home. So, and thank you again, Martha and Andrea and everyone at Senior Concerns, for the work you're doing day in, day out. I send people to you all the time. It's just, I think you're the best nonprofit in the nation, with the Alzheimer's Association doing this kind of work. We're really, really lucky to have this resource in our community.
Well, thank you for that. And thank you for all of the information. I think it is a scary time. And there's, normally a lot of guilt usually associated with placement. And so now I think that that's compounded. But the things that you said are really valid points. And you have to think too about what that quality of life is at home if we're not able to have visitors. How much stimulation can we provide? How much structure in the day versus in a facility, which might actually increase. There might be more stimulation and more enjoyment and socialization there than they're able to get at home. We do have a couple of questions, and Tammy, who is the co-owner of Assisted Living Connections, is commenting that she had a client move into a Thousand Oaks home who was bedridden, but within 2 weeks was walking because of the extra attention that they were getting, and maybe improved nutrition and other things that people were able to look out for. So that's a really amazing story. And then Khalilah, we did have a question from somebody whose mother is at a home, and the home, she's saying, is very stringent, where she's able to visit, but in between feels that mom is really scared and anxious. There's also a question about communicating with her doctor. Can the daughter communicate with the doctor? And Ellen, you might want to discuss that as well. What's the protocol with taking over, being able to communicate with the doctor? So first, Khalilah, I'll ask you to address what to do when the home maybe is being too stringent. Are there ways that we can help advocate for mom?
I'm always happy to talk with families and give them ideas. One that, enabling the senior to be in an outside visiting area, like in a covered porch, where you have plenty of distance. It's much safer, because this isn't going away anytime soon, as we're seeing. So we have to adjust.
Yes.
And I have a lot of ideas for visiting seniors in care homes, since I'm visiting my mom every single week, bringing a packet of pictures that I can give her the packet, so I give it to her. I'm 6 feet away. She's looking through the pictures, and we can talk about those pictures together, and doing things that are really reassuring for her. And talking with the owner about, if mom is scared, there's things you can be doing FaceTime with that senior every day. Besides phone calls, are they providing that FaceTime? What else can they do for interaction? What is the staff doing to interact with the senior, and help her feel more calm and cared for and secure? Because the senior, certainly if the senior does have any memory loss, they're not going to remember that they can't see their family members and hug them, and that there's COVID happening. So it depends on the situation, but I'd be happy to talk with the person asking that question to run over some ideas of things we could do.
And Martha, I would just add, definitely, I think the daughter should feel comfortable to speak with the doctor, try to come up with some strategies. Sometimes medication is the right answer, not always. I don't think it should always be the first choice, but certainly we don't want anyone to suffer. And I think that agitation, that anxiety, that constant worry is a form of suffering. Mm-hmm. And so again, if we can take really good notes on that, there might be a medication, a low dose, that could alleviate that symptom.
Absolutely. I love the way you say that, because I hear that a lot from families. And we always want to look at medication and drugs as the last resort, but it doesn't mean that they're not an important part of that equation.
Absolutely.
And you're absolutely right. That anxiety and that worry, if there's something we can do to alleviate that, we're going to increase their quality of life and reduce their stress. So that's a really good point.
My aunt, just to share a personal story, was very agitated and unhappy, and she lived in one of the local skilled nursing facilities. And her physician ordered just a low dose anti-anxiety med. And then, her life was beautiful. She went on for the next 8 months. She enjoyed all the activities. She was able to participate and enjoy family time. It made a huge difference. So I understand that the press, just as Khalilah says, take everything you read in the media with a grain of salt. There's a far, far difference between using medication as, and I don't like this term, chemical restraints, mm-hmm. and giving the medication that we have created to relieve and alleviate suffering.
Absolutely. And I think that the concept you talked about with keeping a calendar where you log everything, that's a great place to log the behaviors and the concerns that you're seeing too, because it's really easy for us to just say, well, sure, mom's, anxious sometimes. But when you start to see it on paper and you start to see the patterns that emerge, then we might take it a little bit more seriously when we do talk with the doctor. Absolutely. We're getting close to the end, but I have a couple of questions. How can an assisted living community who has been tagged to have COVID be clear when there are no more cases in the residents and staff?
My understanding is that the Public Health Department and Department of Social Services have to clear them, where they test everyone in the community, all the residents and all the staff. So it's their responsibility to clear. Once the testing is done and they get the results, then they clear the community to be able to let residents be free to walk around the community, go to dining, go to exercise.
Yeah, and they're saying that the facility only learned they had been tagged when the paramedics were called and came in with full PPE. So there might be something else going on specifically at that facility, but all paramedics now are coming in full PPE. They are all coming to every situation assuming that they might be interacting with somebody with COVID. So that can feel alarming to us, but that is part of their regular protocol now.
Mm-hmm.
So let me just make sure. Somebody is mentioning that the medication Seroquel has worked wonders for anxiety, depression, and other things. And Seroquel is a very strong medication, but for the right situation, it can really reduce some of the agitation and behaviors. So it's definitely something that people can bring up to their doctors. But I think the best thing is to be really clear about what you're seeing in your loved one. So by keeping that log and being able to operationalize what you're seeing rather than just saying she's mad at me, but again, like Ellen said, what does that look like? Is she throwing things at you? Or is she just giving you the side eye and you just know what that means, but it's really not that bad, right? There's a big difference between those two things. So I know we've packed a lot into this 1 hour, but our panelists are amazing, and I'm so thankful that they would come and share their time and their expertise with us. And if you do have follow-up questions, then please reach out to us at Senior Concerns, and we're happy to connect you with any of the panelists that you would like to speak with further. We have 2 more seminars coming up in August. So the first one will be August 11th, and it's called Will You Pass Your Next Driver's Test? This was always a very popular one in person. So we'll be trying it over Zoom, and we have a woman who is a DMV ombudsman who will be presenting this. So she'll talk all about taking the driver's test, but she'll also talk about the Real ID and the new rules and the extensions that have been provided by the DMV on license renewals. So that's really important information. And that's August 11th at 4 o'clock. And then August 25th, we have Meeting the Challenges of Solo Aging. So are you single? Are you married without children? Or are your children far away and not able to help you? This will talk about how to identify what matters for you and set up resources to make sure that you have your wishes honored as you age. So that will be on August 25th. And we have redone our seminar page on our website. So please take a look, because now every past seminar, we will publish the recorded video of it. So this one will be up within a few days to view. And then any upcoming seminar, there will be a link there that you click to register for the webinar. So that should help all of this go really smoothly. And with that, I want to really thank all of you who attended. I want to thank Mark and Ellen and Khalilah. We so appreciate your time, and I know this has been really valuable for me, and I hope for all of you. And I just want to say thank you to all of you that are caring for a loved one at home, that are giving of your love and your time and filling all those roles, some that you've been doing for a long time and some that you've had to figure out in the last few years. So we thank you for all of that, and I hope you all have a wonderful evening. Thank you.